Are we ready? All right. Hi, everybody. Welcome to the Society of Black Colon and Rectal Surgeons webinar cast today. Today we have some great panelists and a special guest speaker. We are going to be talking about physician side gigs. This is something that I know we've all thought about in the back of our heads. We're burnt out, we're tired, we need more money. So we are here to discuss our own side gigs. For me, personally, I'm a colon and rectal surgeon. I have a little side gig in aesthetics. So that's my side gig. And we were talking about kind of figuring out what we want to share our knowledge. We can talk about all this technical colon and rectal stuff, but this is the stuff that's real life. So let's get into it. We have panelists, so please feel free to leave messages. We'll field your questions and we'll ask our panelists at the end where we'll talk. We'll have plenty of time for questions if you have any, okay? So we are going to start with Dr. Karen Barnard. So she is our guest speaker. She is a retired endocrinologist. She was born and raised in South Africa. She moved to the US where she completed residency and fellowship training. She is board certified in internal medicine and endocrinology, and she practiced for about 30 years. After that, she hung up her stethoscope and transitioned into helping physicians find joy and fulfillment in their careers. She completed her coach training and certification with Coactive Coaches Training Institute and is a professional certified coach with the International Coaching Federation. So please give a warm welcome to Dr. Karen Barnard.
Hi, everybody. Good afternoon, good evening, whatever time it is where you are. And I'm so thrilled you've joined us this afternoon. I'm really excited to be here because you've got some great panelists who've got some good side gigs going on. So I am going to give a little bit of an introduction for just an overview and how you might approach if you're thinking about a side gig, just in very general terms. And then we're going to hear from the panelists and myself. I actually started my own coaching side gig while I was working full-time and transitioned into full-time. So I can talk about coaching as well, answer any questions about that. So I'm going to start off by, this is if you would like to reach me, there's my email. Next slide, please. So, why start a side gig? Christina mentioned that, everybody's feeling burnt out and maybe wanting some additional income. There are actually several reasons in my experience why physicians want to do something different. The additional income is a big part of it, but also really lacking creativity in their jobs. They might be 10 or 20 years in, you've got the physician surgical thing down, and there's just not that much variety or maybe even creativity in your job anymore. And so finding something on the side that can really help to bring that back can be very rewarding. It might not necessarily have to even generate that much income, but just give you something a little bit more creative to do. Things like medical writing, for instance, or blogging, YouTube educational videos, that kind of thing is what some physicians like to do. The other reason is curiosity. So this is maybe, you're thinking about what else is out there? What else could I be doing that can be fun, or that I can meet different kinds of people, that I can use my skills in a different way, and then really experimenting and looking and seeing, what other things might be delightful for you. The other thing is, for many of us who worked Monday through Friday and then on call on the weekend, you kind of just sometimes need a break from patient care. And this could be in the evening. That was for me when I started coaching, even though it was adding hours at night, I really enjoyed coaching. It gave me energy, and it was kind of a break from the patient relationship. You'll hear from Christina, who does, I think, a day or two in a aesthetics practice. That's also an ideal break where you're just doing something different. You're not giving up medicine, you're just getting a change of pace and doing something different. And then I have several clients who are about 10 or 15 years away from retirement going, okay, I'm not going to be full-timing it for the next 10 years. Let's think about how I can scale down my practice and begin to bring in some different income streams so that 10 or 15 years from now, I can say goodbye and enjoy some other areas of my life with enough money to do so. And then I have a couple of clients who have maybe quit or resigned or stopped their current clinical jobs for a variety of reasons. They haven't quite yet started their next gig. And a side gig is a way for them to secure ongoing income between jobs. So as you're looking at this, think a little bit about for yourself, what would be your reason for starting a side gig? Next slide, please. And so one of the places you can start, if you're just like, well, I don't know, I just like some more money, maybe I'm curious, I really don't know. Think a little bit about, what skills do you really love to use? And think quite broadly, because as physicians and as surgeons, I know all of you all have the most amazing training and experience. You have skills coming out of your pores, and you don't even recognize them as skills because they're just what you do every day. But what do you like the technicality of operating? Do you like the educating patients in the room? Do you like to give lectures? Do you love to teach? What is it in your day that really you still love, even when everything else feels terrible and the bureaucracy and the EMR is driving you nuts, or maybe you're the one who loves the EMR and you're out on time, and what is it? Think back on the past week, for instance. What did you do that even when you were tired, you kind of got energy from it? And then similar to that, sort of related to that, is what problems do you like to solve? Are you constantly trying to solve a process flow problem in your clinic? Are you solving problems for patients? Are you, inside or outside of your area of expertise? Are you like somebody who gets really frustrated with the system and I'm going to go fix this thing, and you're really good at it? That's something to look at. You may have developed on the side in your current job some expertise, some really area where all your colleagues know, oh, she's really good at the EMR, or oh, I don't know how he does it, and he gets those patients in and out, and his patient's always satisfied. What is he doing? Right? So you might not recognize that there are some things you really are better at than everybody else around you. Those are the things you might want to look at generating extra additional income from. And we'll talk a little bit more about how. And then again, what do others seek your advice for? And when you go home or on the weekend and you've got 5 minutes of time in between everything else, what is it you like to read? Not what must you read or what should you read for the boards, or what do you love to read? It doesn't have to be medicine. It could be recipes. It could be gardening. Just paying attention. What do you like to talk about? And even for those of you who are writing outside of, just charting your notes, what do you enjoy writing about? So as you're looking at these, just take a moment and just think for yourself, or even write it down. Just take a moment and really look at what is it that you really love doing, that you are really good at, that you could make some money from. Next slide. Next slide, please. Okay, and then some practical considerations. I think the panelists will attest to this, but I don't want to speak for them. But a side gig, even if it's a so-called side gig, it can take a significant time and energy to get going. Sometimes you land into it and it's luck. Other times it takes significant sort of forethoughts and strategy to really get it off the ground. So what are your long-term goals? Are you early career and you still love colorectal surgery, but you kind of want to make a little bit of additional income, but you don't want it to be too much of a burden, maybe an hour or two a week? Or you're closer to retirement and you're like, my long-term goal is I gotta make some money and I got some energy and I can spend some time looking at this. And then, what are your current resources? You'll hear from one of the panelists about real estate investing. You do, while there's active and passive options, you need usually some money to put down on that. But money even isn't the whole thing. It's your time and your energy. And I'm really curious what the panelists also have to say to this, that it always takes longer than you think it's going to get started. That doesn't mean you don't love it and it gives you energy and all of that. But I remember when I started coaching, there was some things I needed to get under my belt, and I did it after hours. Now it was fine. I had the resources, I had the time, but this is not to put you off, but this is just to do a little bit of a reality check. How much time do I really have? In addition to that, we can accomplish more. We underestimate what we can accomplish in a year, and we overestimate what we can accomplish in a month. So even if you only have an hour a week to work on something, don't sneeze at that. That is, use that time. And if you use it well, you don't know where you could be in a year or 2 years. And then the other consideration is, if you are in a W-2 full-time employer type of situation, or you're working full-time for the federal government, you need to also look at what will your employer allow, what's in your contract, and I always encourage transparency in this and informing your employer. I've had some of my clients, it's not a problem, you can do whatever you want. And I've had others where they've had to jump through some hoops to be able to do the side gigs. So that's just something to also consider. Let's see, what's the next slide? All right, so I've got a couple of slides here on some examples of side gigs to consider. And I'm not going to go into depth in each of them. I'm just going to give a one-liner in the interest of time. You've also got a fabulous set of panelists here who are going to be able to talk about many of these things on the list. I also have ample resource documents at the end of my slides with the links. We'll give you more information on each of these, how to get into them, how much money you make, etc. So you can just sit back and relax with this. And if you have any questions, of course, put them in the chat and I can get to them. I think we have a panelist who is going to talk about, actually backing up. I like to always divide side gigs into clinical and patient-facing or non-clinical, and then looking at on-site, remote, and then some hybrid options as well. That's just my way of sort of stratifying these activities. And in general, again, this is really a generalization, but if you're looking for a high-paying side gig right now, anything with patients where the on-site on this left column might be a go-to for you. This is not to say that there aren't other very lucrative options, but if you don't have much time and you just can use your medical brain and your history and physical exam skills, these might get you where you want to go. Locum tenens, a lot of fun. I think, as I said, we've got somebody on the panel who's going to be talking about that if you want to travel, you want to experience different healthcare systems, there are even international options. And more physicians or surgeons are doing locums. When I was training, kind of the physicians who couldn't make it in practice or academics did locums. That's no longer the case. So lots of great options there with good, some of them pretty lucrative gigs. Med spa and aesthetics, Christina is going to talk about. Minimally invasive vein treatments, either as a provider or as an owner of a center, is also a kind of a low stress Monday through Friday, 8 to 5 potential gig that you can make reasonable amount of money with. Wound care, I believe we have somebody on the panel who's going to talk about wound care. And that is actually a great option. And what's nice about wound care is you don't necessarily have to, reinvent the wheel. There are companies that will match you with facilities that need you for wound care, and there are part-time W-2 options. They usually require 2 to 3 days a week, but that's definitely a viable option. Independent medical exams, this is essentially where you're going to provide a medical opinion on functional status or impairment. The surgical fields that that really do well with this are things like orthopedics, neurosurgery. There might be something for colorectal, but I'm not familiar with that. But that's, if anybody wants to know more about that, I can talk more about that. And then just being a physician who's doing exams for new military recruits at their processing center called MEP centers. This is also part-time. Pay is, about a primary care physician's type of pay, but you're not diagnosing, you're not treating, you're not prescribing, you're giving a medical opinion and interpreting data and doing a physical exam. And then your remote options, telemedicine, virtual care, less reimbursement these days with telemedicine since COVID, but still can be a relatively lucrative side gig depending on how you go about it. Advanced practice provider supervision is where you supervise mid-level practitioners, and we can talk more about that if anybody's interested. And then a medical review officer is a physician who actually reviews lab results for employer-generated drug testing program. For this, you do need to take an exam and pass it, but there are part-time options. It's fully remote, and the reason it's patient-facing is because every now and again you have to actually talk to an employee who tests positive and review their drugs and figure out if that's what's causing the flag on the drug test. Next slide. Okay, and then I'm just going to rapidly go through the non-clinical. The on-site for non-clinical, being a medical director or owner of an infusion center or IV hydration clinics. These are the clinics that are popping up that give vitamin infusions. This is not, oncologic, chemotherapeutic type of infusions. This is fluids and vitamins for athletes. And those apparently are pretty lucrative if you're an owner. If you're the medical director, you'll be overseeing the medical operations and make sure that people adhere to protocols and guidelines. The other option that's a little bit more higher intensity, but if you are really interested in research and you may be looking at ultimately getting a job in pharma, this is a nice way to kind of get a taste. It's actually being a principal investigator using your own clinic as a research site. You will need to adhere to the protocols of the drug study, etc. But some physicians, a day a week is dedicated to using their site as either patients come in, they get their drug testing, their exams, whatever it is, whatever the trial is about. And then remote medical knowledge consulting. We've got one panelist who is on the verge of signing for a consulting gig, and I can talk more about that as well. Paid medical surveys is another kind of easy way, but also not as high yield, but it depends, high yield in terms of salary, but it really depends on what kind of survey you're doing. If you are a specialist, as you all are, you might be able to sign up. You sign up for various medical survey sites, and they send you a screening test to see if you have the criteria that they need. And, you can get paid for an hour. Sometimes those go up to a couple of $100. It's not a lot, but it's very low stress. You can do it in the comfort of your couch. Speaker and media personality, you have somebody on the panel who does speaking gigs, can be highly lucrative, a ton of fun. So get your speaking on. You can all speak. It's a lot of fun. Media personality, we think of television, but there is a physician I know who is a YouTube, does educational videos on YouTube, and he now makes more in a month in his YouTube videos than he does in a year as a primary care doc. But still, he's really having a lot of fun with it and doing education stuff that he loves. Lots of options in medical or other writing, which we can talk about. Again, that often takes a little bit of time to get started. There's a little bit of a learning curve, but it can be anything. I have a client now she is actually writing the medical social media content for for primary care practices, the patient education materials, all of the social media content, and she's having a blast. Coaching, all types of coaching. I mean, you think in every area of life, there's a coach for that. And again, I have a resource to tell you more. I'm happy to answer questions about that. Education, I have a client who was an anatomy instructor before she went to medical school. She is now 1 day a week teaching dissection in an anatomy lab at the closer medical school. And it's just given her the break and delight that she needs. Not much money in that, but she's really enjoying it. You can also do CME writing. You can do test prep questions. I mean, there's a ton in education. I have another client who's an ED doc who on the side is doing simulation, and she's traveling all around the country doing simulation at schools for emergency preparedness. And then real estate, we have somebody on the panel that's doing real estate. A lot of fun, potentially highly lucrative, and then VC and stock investing. So I'm going to stop there. And then Christina, it's over to you.
Wonderful. Thank you, Karen, for that overview. So now we are going to pull up our panelists. I am going to introduce them one by one. Thank you, Dr. Collier, for joining us. We will just give a brief intro into what it is that we do on the side. And after that, we will open up the audience to the panelists. So first, we will start with Dr. Irlna Tantchou. She's a colorectal surgeon at Highlands Oncology Group in Northwest Arkansas. She is board certified in both general surgery and colon and rectal surgery. She's completed fellowships at the University of Texas at Houston and at St. Vincent's Hospital and Allegheny Network. And she does a couple of things. Most notably, she is a robotics master, and she is a prize consultant for Intuitive, and she's going to briefly speak to us about her experience. Dr. Tantchou, you're muted.
Thank you. Thanks, Christina, for inviting me. I'm truly honored to be here. I'm just gonna kind of talk briefly about how I got involved with Intuitive. So when I transitioned to private practice, I started really focusing on growing my robotic practice because that's where it was really important for me. And as I started diving into that world, I started noticing two things. The first thing is there was no Black women that I've ever encountered that was a proctor that had been at the Intuitive courses that I could find on the website, that I could see teaching courses. So there was a lack of representation that I felt was a presence that was needed as a Black female surgeon. That's kind of what I was looking for. And the second thing was when I was doing private practice, I missed teaching because I started in academics before and I just left it because of the politics, but I missed teaching. So as I started growing in my robotic practice and becoming more and more facile, I kind of got approached by the robotic rep who, she and I started talking, and I started talking about my vision and sort of what I want to be involved. And if I want to be involved with Intuitive, these are the two things that are very important to me. There was also, I think for me, my robotic practice was really, really traumatic in the early stages of my career. I had so many roadblocks that were put upon my path, mostly because of my gender and my race. So when I got involved with Intuitive, I told them that my biggest focus is young female surgeons. I wanted to empower young female surgeons to grow their robotic practice if they wanted to, and kind of tell them a little bit of what that looked like, because I came from like not knowing any robotics to all the masters and the cases and all that good stuff. So that's kind of how I got involved. I started proctoring for them, which I thought was really, really, really fun. And not to sound crass, but it was easy money. Because as you're operating, the biggest, as a colorectal surgeon, when you're making an anastomosis, you're strained, you're stressed and everything about the leak and all that stuff. And here I was in an operating room in a situation, and I had absolutely no stress. And I got to teach surgeons. So there wasn't a stress of a resident doing the case, a stress of a fellow. It was another surgeon. We were speaking the same language. So I thought that was really, really fun. And I really enjoyed every time at the end of the case when I would debrief, the look on the other surgeon's face was just very rewarding to just feel like I had impacted another person's career. That was really, really impactful for me. And as I kind of started delving a little bit more into intuitive, they started asking me to speak at certain functions. So I've spoken at the Women in Surgery conference, the Women in Surgery in the Da Vinci Surgery conference, and I got compensated for that, just to kind of share about, growth in the robotic practice and everything like that. So that's a little bit about how I got involved with intuitive. And I recently got an opportunity to be an expert witness, which is another thing that I actually forgot to mention, but that's also really, really lucrative. And it's a really great side gig, just because that really, it required time, of course, but the energy wasn't really, it wasn't that much energy to be put into the case. And it was kind of basically do everything that you do and just talk about your expert opinion. And I felt like that was also fairly easy to do, and a really nice passive income. And I am interested to hear about Dr. Nkem, because my husband and I started an Airbnb, and we want to kind of get a little bit more into the real estate world. So that's why I'm here too.
Thank you, Dr. Tantchou. And well, thanks for the bridge over to Dr. Nkem Ezeamama. She is a emergency medicine physician at TriStar Skyline Medical Center in Nashville, Tennessee. So welcome. She holds a bunch of different things. So she's the member of the core faculty of the medical center's emergency medicine residency program. But what makes her really remarkable is that she's a real estate investor. And she's CEO of Phoenix Capital Investments, which is a multifamily real estate investment company. And she's going to talk to us about her journey into real estate for medicine.
Hi, everyone. So, of course, I woke up this morning and I lost my voice, but we're going to press on. So if I sound a little croaky, I'm sorry. But my name is Nkem, and I'm an ER physician, and I loved what I did until around COVID. Things really changed for us in the ER. We were losing jobs, our hours shrunk, our pay structure changed. And it was at that point that I was like, we cannot keep depending on one employer for a source of income. And so I had dabbled in stocks, but that was the time I said I was going to just take a chance on real estate. I noticed that a lot of the wealthiest of Americans, where they owned real estate, and I said, why don't I just dip my toes in it? So I started off as a passive investor. I invested in an apartment complex, and within 3 months, I started getting distributions. I started getting money back, and I was part owner of something, and I was still working in the ER. And I did another one, and it made sense, and I got proof of concept, and it didn't stop me from doing what I loved. But then I could also be growing wealth. And the beauty of it was that it was passive, is that while I was sleeping or while I was working in the ER at 2 a.m., my money was working for me. What I did is I relied on the power of social media, and I started telling people. I started talking about it, and I was like, why don't we know this? We as healthcare professionals, we as physicians, we have resources, but we don't have access. No one is telling us about all these alternative sources of income that we can make. And we work so hard. And so I did that. And, I reached out to friends, family, colleagues, and I said, hey, we're going to start buying apartment complexes. We're going to pull funds together through a process of syndication, and we're just going to start buying, and we're all going to grow wealth. It's going to start off. Real estate investing is a long-term approach, but we're going to start somewhere. We're going to sow the seed, and we're going to grow. And so we started investing. Before I knew it, we invested in 1, we invested in 2, we invested in 3, we bought 1. And now we have $46 million in assets under management under Phoenix, and we're about to purchase our next one. And, I sit here today just at the power of, deciding that you want to do something and going after it. And, right now, 2024, emergency medicine field is the most burned out field. And so we're at 68%, I think. And so people are really, really struggling. We are losing jobs. And so it's what are the other ways that we can grow wealth? And that's so Dr. Tantchou talked about Airbnbs. There are so many different ways in real estate. It's what do you want to do? And we focus on apartment complexes. We purchase in the Southeast, and really we target healthcare professionals because I want you to continue to do what you love and work hard. But like we work so hard, and I want us to grow wealth. I want us to really, really think about what wealth means. And that's like in multiple facets of life, you can be wealthy. But as hard as we work, we want to grow wealth, and you can do it passively too. So that's how I started. And now I talk about it. Now I encourage physicians. Now I educate physicians, because we are experts in our fields. We're experts in medicine. And I'm so proud to be like among all these colorectal surgeons, and you guys are experts, but nobody teaches us about wealth. Nobody teaches us about finance. Nobody teaches us about real estate. And so we have to go out there and learn it ourselves, and then bring it back to our people, healthcare professionals who are working so hard, who are on the front lines. So that's what excites me. So I'm excited to be here. I can't wait to answer questions, but that's a little bit about me and Phoenix Capital Investment.
Awesome. Thank you so much. All right, our next panelist is Dr. Derek Collier. He joins us. He is a surgeon and intensivist. He's also the chair of surgery section of NMA. He is a full-time locums / independent contractor for the last 9 years. This is something that I think locums, we always have it in the back of our heads. I think, when we're trying to figure out how's extra money, what can we do that's low stress? So Dr. Collier is here to tell us about that.
Okay. Thank you all so much for having me. And Dr. Nkem, I sent you a friend request on LinkedIn. Check that out for me. Now, I got into locums kind of out of fellowship, and to be clear about it, I expected one position to work out, and when fellowship ended and it didn't, I started doing the locums, and it was actually like kind of, wow, I like this, in terms of I was able to pick my schedule. And if I didn't want to work a day or had other plans or something, I just said no. And there was no, and they could say please, or we'll give you a bonus. But if the answer was no, it was no. And I came to really enjoy that. And I did that at first for a few years. And then I took an academic position, and there were politics at that institution. And, when I left, I said, well, let me just go back to locums. And I ended up just making pretty much a full-time career out of it. A few of the things that I enjoy are that, one, I'm able to serve a number of underserved communities and go in places that matter to me. For instance, during COVID, I have 3 sisters, my parents, and my son who lives with his mother. And I said, okay, well, I'm going to pick a site with him. I'll pick a site near each of my sisters who live out of state, and I'll just rotate between those sites. And that's pretty much what I did during COVID. And, kind of there again, you still have the flexibility of your schedule, such as, now when I have him with me during the summers, I'll just say, okay, I'll work when he's with his mom, but when he's with me, I don't. And I did take him with me on one trip earlier this month, and I took my parents, and we just had a tour of San Francisco, and it was just kind of nice to, he got to see me, go to work for whatever enjoyment he got from that. And then we got to explore a new city, explore Northern California with my parents and him. And so it's been good for me. I would say it's a little different between the specialties, and what I mean by that is in critical care. If you see how your intensivists generally practice, they're probably on a week on, week off schedule. And so whether that person is 2 miles away in their house or 200 miles away, it doesn't really matter because you don't see them anyway. What I tell people in terms of locum surgery is you have to be comfortable. It's not something I would do the first year out of training. And I say that because, if you have you're there because there's nobody else there. So if you have somebody's, 3 times redo LAR who comes in with a leak and it's just a Saturday night and you and a scrub tech, you have to be comfortable with that. Or, or if it's if some other disaster comes in, or if there's nobody to call in. You see what I'm saying? And so or the other example I was going to give, if you operate on somebody on your 7th day and you leave drains, okay, who's going to take them out? Some surgeon you don't know and who doesn't know you, and all that. And that's not to discourage locum surgery, because locum surgery is obviously better than having no surgeon there. It's just, I think you have to be comfortable, and it's not something I would advise for somebody in their first year, is the only caveat I would say.
Thank you, Dr. Collier. And we also have Dr. JoAnn Warrick. She is a board-certified general surgeon and board-certified colon and rectal surgeon. She is not only a colorectal surgeon, but her venture also, her side gig is wound care. So she has an interesting journey, and I would like her to speak about it. Go ahead. I think you're muted.
And you are correct. Good evening, everybody. Thank you, Dr. Jenkins, for the opportunity. Good to see you and Dr. Tantchou back here in I'm in Maryland, but in Baltimore for our ASCARS meetings. It was good to see you guys in person. And Dr. Jenkins is correct. So I am a colorectal surgeon. I practiced up until 2019. I was living in Louisiana and did private practice there in Louisiana. And I did have a lot of politics that I was dealing with at my private practice, because my husband is a GI surgical pathologist. And we moved to Louisiana for his opportunity, but it eliminated a position for me. But his practice, his GI practice, created an opportunity for me. So I was their colorectal surgeon within a group of 14 GI guys, and they were all guys. What ended up happening with that is, of course, the politics that comes with scoping and all of the abdominal cases and everything. So I had to fight that battle for about a good 6 years. And after a while, it's, you don't want to do that anymore. We had an opportunity to move to Maryland, and I was going to resume colorectal surgery. But at the same time, we had a young daughter. And I was thinking about, how do I become more present, as she kind of thought that my mother was her mother. And I was like, "Ooh, no, we need to sort of fix that." I interviewed for a colorectal position in February of, I think it was 2020. And about a week or two later, the country shut down for COVID. I was fortunate enough, it kind of really just landed in my lap. There was an opportunity at Johns Hopkins for a burn and plastics reconstructive fellowship that I did for that year. So going back as old as I was and taking call and doing a completely different specialty after being out for about 12 years is always tough. But I went back and did it with the goal of going and transitioning into wound care. When I finished the fellowship, I did stay on at Hopkins sort of in a part-time fashion to do burn. And then I did my wound care as an outpatient. I went to a facility and the patients came to me. I also did hyperbaric treatment there. And the first company that I joined, you have to sort of take like a hyperbarics course. And, it was a pretty long hyperbarics course, but, it became well-versed enough to do it and to get the patients that you needed to do hyperbarics and sort of manage it. And of course, the nurses do the majority of that with that. And so I continued at Hopkins for a while. Actually, I will be finishing that gig here next month. And then I transitioned to wound care inpatient. And so right now with the company that I work with, I have, I now go to facilities. And after talking and hearing Dr. Tantchou and hearing all of you sort of speak about your side gigs, and Dr. Barnard, you guys are absolutely correct. We do have a skill set that we don't realize that we're using that is actually a side gig. Well, I have also done consulting. and you don't think about, oh, I did this consulting gig. It is a side gig, and you've actually done it. So I did that. And then so now I still continue to do wound care at the facility. I currently work about 3 days a week, and I'm able to create my schedule. I actually leave for vacation in the morning with my daughter to see her cousins. And that's one of the great things about that, is to be able to curate my own schedule to meet the things that I need in the life for my family. The other thing about wound care, and after listening to Dr. Tantchou talk about, taking care of patients or teaching, one of the things that I really liked about where I am at the facilities is patient advocacy. And we are really taking care, when you see some of these wounds and what these patients are sitting in and what they're dealing with, you really have to be a voice for them and make sure that they're getting the care that they need. And I think one of the things, us being surgeons, we know how to fix things, and we know when something doesn't look right and when we can do it within, within what we have at the facility. And so it has been a good experience so far. And like I said, it's one of those things where I can create my own schedule. I can do what I need to do for myself, for my family. I can choose to work or not work. But I also get to interact with patients and actually continue to show them that they're humans. And I think sometimes when you think about nursing facilities, a lot of these people, their families are no longer there, and they feel like they are not a part of the world or a part of the society, part out of our normal society, because they're sort of in this home. And so it's good to view them and see them and see their humanity. And I think that's one of the things that I enjoy doing with my wound care position. And the next thing that I would say I'm getting a little bit into is a little bit of, again, consulting and doing that a little bit more in depth as well.
Wonderful. And I'll just give a brief intro to what I do. I'm a colon and rectal surgeon out here in Southern California. And after years of practice, I finished my job at Loma Linda University, and I decided to live the anastomotic-free life, which is much nicer, focusing on outpatient surgery. And what fell into my lap was actually aesthetics, a position as a medical director of a medical spa locally here in Irvine, California. So I was able to do that, where I would go in and just sign charts and supervise things. All I had to do was basically notify my malpractice company. And surprisingly, there was no change in my premium, which was great. So after a few months of just watching little nurses inject these giant fillers into people's faces and doing lasers, and I was looking at all the risks, I said, well, these are little baby nurses coming out of nursing school, and they are struggling to put IVs in, yet they're entrusted to put these huge injectables in people's faces. I should be doing that. So I signed up for a course, and then I hooked up with some of the reps from Allergan and Galderma, and they provided training, hands-on training for me as well. I got some certificates, and I started doing it myself. I don't do lasers, but I said, I'm just going to do some fillers and some Botox. And let me tell you, it's been really fun. So now 1 day a week, I sit at the spa and I do these fun treatments on these very happy Orange County housewives. So for me, it's been really great. Also, with something to consider, this is something that can be lucrative, but there's a lot of overhead to consider. So lots of things that to factor in. So this is why we're here to discuss if anybody has questions about how to get started on these different side gigs. For me, again, it was living that stress-free. It was a work-life balance, balanced children, home life, and just anxiety. And this was a fun way to add for me while making some money on the side. You get paid to be a medical director, so that's something that everybody can look locally for. These weight loss centers, a lot of nurses want to start giving people semaglutide and tirzepatide and all these weight loss. Those are things that you can become a medical director of. I do weight loss medicine on the side too. It is part of have this skill set. This is not something you don't know. So I also do that. So these are little things that we have. Like I said, we have these surgical skills. Why not use them? So With that being said, we're going to open up the floor to our panelists. Dr. Barnard, do you have anything to add? I know we have a pretty good group here. Do you have any other comments, or should we open up the questions?
Yeah, thank you, Christina. And I think we should open up for questions and see what people want to know, and then we can go take it from there.
Okay, so one of our questions is for any of the speakers, can you talk about how if any of the side gigs that you have done have affected if you have a non-compete clause in your contracts? Does anybody run into that issue? Non-compete clause and having a side gig, locums, for example, or wound care. Anybody?
No, I haven't encountered that. No. Now with locums, if you get presented to a hospital by a company, typically you can't present for another company or take a side. Or if the hospital wants to hire you directly, then they have to pay a fee to the locums company for quote unquote finding you. Or you can't sign with another company at that hospital for 2 years. But that's been the only non-compete issue that I've encountered.
Okay.
I haven't encountered. Sorry, go ahead.
Oh no, go ahead.
I was gonna say I haven't really encountered anything, and I think that that's the beauty of doing like this side gate of Intuitive, because I'm essentially getting paid by Intuitive. So, and I'm not I'm not doing the surgery as they're being whatever speaking engagement I'm having. None of my patient care, like there's no impeachment in it. So I haven't had any issues with.
Okay.
And I was say not a direct non-compete. However, if you do work for a wound care company and say you decide to leave, you cannot go to another wound care company and say, hey, send this patient from this place over to where you are at the other facility. I do work for 2 different companies, and they're both all aware that I work for the other company, but there's no, you keep things separate. You do not, try to solicit the patients to come to the other place, but you can pretty much go wherever. And if you do want to go off on your own, there would be a little bit of a challenge in terms of going into that facility where you were under the umbrella of the other company. And there would be some legal things with that. But outside of that, that's the extent of what I've had to, think about.
Dr. Nkem, I have a question for you. I think a lot of us perked our ears up when we heard that number, that figure you said. So when you're starting to real estate invest, do physicians have to have a certain amount of capital? We're always worried about risk with lawsuits, et cetera. So like if you're investing in a multifamily unit, for example, what are the personal risks to your income when you're doing that, as far as, insurance for the homes and weather and tenant issues? How does that work?
Oh, okay, great question. So when you are investing as a physician, you are a passive investor. You are a limited partner. So you are bringing funds into the deal. So we have everything else is taken care of. So insurance, lawyer fees, accountant, all of that. So you are not liable. We have, with each deal, we purchase significant amount of insurance. And so that covers fire, smoke, tenant, everything is covered under that insurance bracket. So you don't have to do any of the worrying. You literally just put funds in, and then you get to do what you do. So the downside to this is that you are not a decision maker. You really just want to be passive. You want to be on the side. You don't want to think about toilets, tenants, troubles. You don't want someone calling you at 2 a.m. in the morning, because we have professionals that take care of all of that. So for instance, we're purchasing a really large apartment complex in Atlanta, and you're not doing anything. All of that, we are taking care of everything for you, but you are bringing the capital. So you're enjoying in the upside of the deal without any of the problems up front.
Okay, thank you. So this is a question for all the panelists. With all your side gigs, have you had any issues with your partners as far as having negative feedback from partners or complaints for your side gigs taking up too much time?
Yes. But my partner is a special individual. So Yes, in the sense that when I started doing that, one of the downfall with proctoring, and just proctoring for intuitive, is that these proctor opportunities come as they come. I have a limited amount that I do per year just because I don't want to travel too much. But they come, like they'll call me like a week before, give me like a month notice, sometimes even less than a month notice. So sometimes it's a matter of juggling my schedule a little bit to try to fit if I want to do it and if I don't or not. It has affected a couple of times my partner. He's made a couple of comments, but just a quick there. And that kind of solved it. So it wasn't that impactful to my practice, and it's usually sort of like just a day, and then you come right back. As far same for the speaking engagements.
So I want to comment on this a little bit because I think that in the beginning, it's going to take a little bit of time for them to realize what you're doing, understand it. And it comes with almost like an identity shift. So a lot of us think that the only thing that we're supposed to do is be a physician, and it's work in the hospital, it's work in the OR. And so when they see you, there's a level of being threatened by that, because you're stepping out, you're doing something different, you're challenging the norm. So I think that there's a level of understanding that comes with it. And the more they know, the more they get to understand, I think there's also going to be some acceptance, but you have to be sure, you have to be resolute about what you're doing, because it's very uncomfortable to others who are not doing the same thing.
That is such a great point. Can I just piggyback on that because that's actually a really, really good point, is not understanding what you're doing. Because what I explained to him was part of the reason I'm doing this is because, and I think we talked a little bit about that, Karen, is I don't want to be an 80-year-old operating. I don't want to be a 70-year-old operating. I don't want to be a 68-year-old operating. My career in my head needs to stop at 65. I find that ridiculous to have arthritis and be able to have an anastomotic leak. I want to leave an anastomotic free leak at some point. And I think that this is creating the path for that. And you're so true about, really explaining that to the other side sometimes can help. I mean, sometimes you can't, because like I said, my partner is a special individual, but I think that it's a really, really great point is, knowing why we're doing this.
And I also think too, being upfront with yourself in terms of what your goals are and what you want to do. I did run into at some points when, say, wound care wanted me to be there and then the hospital wanted me to be there. But I have to say, hey, remember, I am part-time. Remember how I signed this contract. Remember, this is what I signed up for. So you stand firm on that and say, look, there should be no hard feelings, because I've made it very clear in the beginning what my capabilities are, when I can say yes and when I can say no. And I think for us as surgeons, having no be a complete sentence is sometimes a challenging thing. And so sometimes you have to say no and walk away without anybody's feelings being hurt, and standing on that, and realize, that you have to do what's right for you in that moment, especially if no one's being, hurt or affected by it. Then you need to do what you've set out to do, and what you've said, this is what my plans are. So.
Sorry. They're just going to move on because we have a couple more questions and not that much time left, surprisingly. So one of the questions are, so for the locums, Dr. Collier, how do you handle the lack of follow-up and complications? If you do a colectomy in the last night of your assignment, what happens if there's a complication?
Okay, well, that's what I was saying before. I do purely critical care as locums, and so what I sign out is what I would sign out even if I were in a full-time practice. So it's not that different. I haven't personally done surgery locums, so I wouldn't want to take that question. But that's the caution earlier when I said I would not do this in your first year out. Oh, it's only when you're comfortable.
Okay.
Though to take the prior question, I'll just say the one of the beauty of locums is you have no partners so you don't really answer to anybody but yourself and your family.
Awesome. JoAnn, there's a question about the wound care. Are there any companies that allow you to do smaller level wound care without needing the burn or wound care fellowship that you know of? Or
Oh, absolutely. Yeah, absolutely. I think there are a lot of companies that you do not have to do any fellowship at all to do wound care. I think the majority of us know how to do wound care, and a lot of the different companies will put you through a fellowship program. The one company that I'm with right now, I had to do, no matter my experience, no matter that I did a burn and plastics reconstructive fellowship, I had to do their 6-month wound care fellowship. And I just actually, I started this one back in November, and I finished that. And it's doable. It can sometimes seem annoying when you have to read articles and do this and, meet with your fellowship director weekly, but it's definitely doable. But no, you do not have to do a fellowship at all. It was just something that I wanted to do because as a colorectal surgeon, I was thinking to myself, who would say, oh, let's hire a colorectal surgeon to manage these wounds in a facility? But in doing the fellowship and understanding skin and doing burn, which is wound care on extra special steroids, I knew that, I couldn't be challenged with my skill set. And so I kind of always come from the place of, you can never question what my skill set is. And so that's why I went ahead and did the fellowship, but you do not have to. We have a lot of family practice doctors, internal medicine doctors, orthopedic doctors, vascular surgeons who have never done a fellowship that come and do it.
Dr. Barnard, can you speak about the military entrance processing exam and how do you get information about it? What is it, becoming an examiner for that?
Oh, yes. I just want to piggyback on something JoAnn said about wound care. In my resource document, I connect to, I don't know if you're familiar with VORA, JoAnn? Yeah.
That's who I'm actually with right now.
Yeah.
Yeah.
So there, I have a link there, and you can actually, if you look at the job postings, there's lots of openings for, and I have clients who are family medicine trained, internal medicine, who are doing wound care and really loving it. So just to underscore what you just said, JoAnn. Yes, so for the MEPS exam, there's actually a site that you can go to that is in the link is in the side gigs article that I've done in that I have connected in the resources. But you can go to the website and you look at, because these processing centers are in different cities around the country. And you can go to the site. They're the recruiters for these cities, and you can see if there's anything available in your city. And usually there's no training required. You may need to do a little bit of sort of just federal kind of, some sort of orientation, but it's not a long and drawn out training. And then you can sign up. You can sign up for as much as you want, but they usually like for you to be able to do a couple of days, but you maybe actually be able to sign up for less. The average pay, now it depends on the region of the country, but you're looking at about $90 an hour for that. So it's kind of a little bit less than a family medicine doc pay. But the recruits come in, you do the exam, you take their history, you may need to review if there are lab tests or something from their physician, you review that. And then that's all you do. And you have an assessment based on, what you think they're functionally are capable of doing. But you don't make a determination if they can come into the military or not. That's not up to you. You just kind of gather the data, do the exam, and then present the case. It's apparently, I haven't done it myself, but I believe I've heard it's fairly low stress there. It's not like you've got to, examine 50 people in a half day or anything like that. It's a pretty low stress setting. And the link to that recruiting site should be, is in the article at the end I think, Christina, everybody's going to get a copy of the PDF.
Yes.
And it will be there.
We'll post all this at the end of the talk.
Yeah.
We only have a couple minutes left. There's some questions for Dr. Tantchou, a lot of interest on this intuitive training. We'll start with one of the questions. One of them is, how do you get the attention of the industry? I think a lot of people who are robotic surgeons say, okay, well, I do robotics. So how did you get involved in that? And how do you get started with intuitive or any of these industries?
So I think that for me, it really started by,
To
oh,
proctor.
I have one. I have what?
And how many cases do you need to proctor before
So
you need
you
to become a proctor? Yes.
okay. So let me start with that. To become a proctor, you don't need a certain amount of cases. I think that for me, it started because I was very vocal about the interest in wanting to to be a total robotic surgeon. All my abdominal cases are robotically done. I don't do anything laparoscopically anymore. I think that's where it starts. And I think that once you start that way, you usually kind of elicit the interest of usually your regional rep. And I think after that, it really continues with a conversation and your interest. They are always really looking to have proctor. They're really, really interested in trying to get everybody to be involved. But I think some of the things that they like to hear is a total robotic practice, is really your belief in the robot, why you believe the robot. Obviously, you have to have good outcomes. You have to have good length of stay. So all of those really, there's quality outcomes is kind of how the conversation starts, right? Is they start noticing that, oh, okay, you did this and you did that. Oh, you're doing this. Like, oh, you can do it right that fast. You can do this. You did this technique that was interesting. This technique. So it starts by engaging the rep. When the rep started coming into in my room, I started really sharing with her the little tricks that I do that is a little different than X, Y, and Z, why I don't take as long as some other people, or I started talking about my data and my outcomes. And then that conversation led to me having a meeting with her manager and, then expressing my interest in really wanting to teach and wanting to do speaking and do all these things. And then the relationship kind of got deeper and deeper and deeper. So that's really where it starts. I think it starts with, hey, do you really have a total robotic practice? If this is something that you're really, I hate this thing. If this is something that you're really interested in, then starting by really having a total robotic practice and then starting a conversation with your CSR, like your regional robotic rep. And I think that once those two are involved, being vocal about it is definitely the next step.
Great.
But please feel free. I mean, there's no time. So feel free to email me, contact me, text me, and we could talk further about it, about how much I make when I proctor, because I'm very transparent. I believe in transparency, because as we talk about side gigs, I love that Dr. Nkem actually vocalized the number, because as physicians, we always forget to vocalize the actual number, right? Because at the end of the day, that's important, because I'm not waking up for $200. Like, that's just a waste of my time personally. So, I can tell you what I make and you can see if it's worth it, yes or no, and depending on so contact me if you need to.
Okay. All right. So there's a lot of questions we could do, but we're kind of going over our allotted time. So, there was one question about finances for this. I know most of us talk about, we're talking about our side gigs, but if anybody again feels comfortable talking numbers. So for example, there was a question about medical directorships, how much you can charge. So again, this can either be a numbers thing. So for me, when I started as the medical director, I basically had them pay me about $3,000 a month just to be the medical director. And that would require me doing an hour of work a week. So that would mean going in and signing charts and reviewing the charts and making sure all the protocols were in place. And then in addition to that, I would charge separately for my injection services. So not an hourly rate, but I would go in and I'll say, okay, well, you want me to inject this person, you're going to be paying me more than your nurse. So per syringe, you're going to pay me this, and et cetera, per procedure. And so things, again, because you're an MD, you can have this. So if anybody else wants to talk money and feels comfortable, if you don't, we can do that in private conversations. But that's also a question.
I'll break down our numbers a little bit. It might be a little cumbersome, but for every deal that we find, we charge a 3% acquisition fee on the cost of the deal. So if a deal is 20 million, we'll charge 3% acquisition fee. And on a monthly basis, we charge a 1% asset management fee. So to manage the property, we charge 1%, and then that's it. And at time of sale, after you've made your money, in the profit share, we split it either 70-30, 70% goes to the limited partners, so all the investors, and 30% comes to the general partners, the managers, the operators, or 80-20. 80 goes to you and 20% comes to us. It just depends on the size of the deal, how we're running it, how we're managing it. So it's not easy numbers, but that's how to know. And that structure kind of aligns with your interest as well, because other than the upfront fees, we don't get paid anything until you make your money.
I think with that, we are going to end our webinar. I think this was a great webinar, and I think in the future we'll probably have another side gigs part 2 webinar in the future. Oh, go ahead, Dr. Collier.
Just one thing I want to say, with locums, in addition to the flexibility for your family, you also have the flexibility of professional development. And, you know, I got an MBA and didn't have to ask anybody. I've attended all the meetings and leadership positions in the meetings and didn't have to talk to anybody about it. And that's one of the other benefits of flexibility, going on what Dr. Barnard said about finding out what you're interested in and doing it. Sorry, I don't want to cut you off. I just want to...
But that proves our point, right? Why do we do our side gigs? Like Dr. Barnard said, we do it to find our joy again, to find our peace, to protect our peace, and to really enjoy and honestly use these skill sets that sometimes we are so afraid, we're so limited. We think because we're doctors, we can't do these other things. We have the brains. We got through med school residency, which is horrible. And if you can get through all those things, you can do anything. So I would like to say thank you to Dr. Barnard. We are going to be posting up some links. And then we posted up a link on the comments. Adelso is going to put Dr. Barnard's link up there, and she'll post it up. Yes. So you can email her if you have any questions. Let's see. And then you can just email her, and her website is drkarenbarnard.com. And again, all those links, and if you want to schedule a private consultation with Dr. Barnard, she's available for that as well. And if you have any questions, let the society know. We're so grateful for you joining us this evening. Thank you to our panelists for taking the time. Thank you to Dr. Barnard as well for joining us. And we will see you next time. Have a great summer, everybody.
Bye, everybody. Thank you.
Bye.
Bye, everybody. Thank you.
Thank you so much. Have a great day.
Thank you, everyone.
Bye-bye.
Thanks, everyone.